Human health does not exist in isolation. It is deeply connected to plants, animals, and the ecosystems that make up our planet. Nature plays a fundamental role in keeping people healthy. More than 28,000 plant species are used for medicinal purposes. Today, 70 to 80% of the global population relies on traditional medicine as their primary health care. Trees and green areas filter pollutants from the air and water, directly benefiting human health. An increase of just 10% in watershed forest cover can reduce water treatment costs by 5%. But this balance is under threat. Human activities are destroying and degrading the natural systems that sustain life. This degradation harms ecosystems, animals, and directly impacts human health. Deforestation and habitat degradation lead to biodiversity loss. These changes create conditions that favor species capable of transmitting diseases. As forests disappear, wildlife is forced out of natural habitats. When humans and animals come into closer contact, the risk of zoonotic disease spillover increases. Pollution and climate change are intensifying heat waves, floods, and droughts. These events contaminate air and water, threaten food systems, and worsen respiratory and infectious diseases. For every hectare of Amazon forest burned, 650 new respiratory and cardiovascular infections are reported. As ecosystems degrade, human health suffers. We see more pandemics, malnutrition, mental health, stress, and vulnerable communities pushed further at risk. Human beings are responsible for much of this destruction, but we can choose a different path. The One Health approach recognizes that healthy people need healthy ecosystems. It brings together nature, society, and health systems to work as one. Conservation protects ecosystems and biodiversity. By preserving natural habitats, we reduce disease risks, safeguard clean water, and strengthen food security. Protecting indigenous territories in the Amazon alone could prevent more than 15 million respiratory and cardiovascular cases, saving nearly $2 billion in health costs. Restoration helps damaged ecosystems recover. Restored forests, wetlands, and soils improve air quality, regulate climate, and support life. Restoring 6 million hectares of Brazil's Atlantic forest could reduce hantavirus-transmitting rodents by 98%, lowering disease risk for 2.8 million people. Nature-based solutions work with nature to address societal challenges. Protecting mangroves reduces flood risks. Urban green spaces cool cities. Sustainable agriculture supports healthier diets. Spending time in green spaces reduces stress, anxiety, and depression. Nature encourages mindfulness, physical activity, and social connection. These solutions do more than protect the environment. They strengthen public health, build climate resilience, and create more equitable communities. By investing in conservation, restoration, and nature-based solutions, we invest in our collective health. For these benefits to last, careful spatial planning is essential. Where and how we intervene in nature determines whether we reduce risks or create new ones. IUCN is integrating One Health across its work. By protecting and restoring ecosystems, IUCN advances solutions that benefit conservation, human health, and animal health. When nature thrives, we all thrive. Together, we can build a healthier future.
One Health reflects a simple but powerful idea: that the health of people, animals, plants, and ecosystems is deeply interconnected. We are one, people, flora, and fauna, as well as the planet we share. This is why One Health is a central priority included in IUCN's 20-year strategic vision and is clearly defined as a key contribution to the 8 global transformations for nature and people under our 2026-2029 program. At IUCN, we are committed to championing the One Health approach, embedding it across our programs, policies, and day-to-day operations. This means bringing together conservation, human, animal, and ecosystem health in a more integrated and systematic way. It also means to create, scale, and integrate conservation tools and innovations with public health initiatives through cross-sectoral partnerships. By strengthening collaboration across our 19,000 commission experts and more than 1,400 members, including governments, non-governmental organizations, and indigenous peoples, IUCN aims to lead by example, showing how conservation and health agendas can work hand in hand to deliver more resilient, sustainable outcomes for both people and nature.
Through this dedicated output, IUCN sets out how the Union will advance the application of the One Health approach to meet the Kunming-Montreal Global Biodiversity Framework targets, supporting policymakers, government agencies, public health experts and educators, zoos and botanical gardens, veterinarians, scientists and conservation professionals. This includes integrating health into conservation considerations and vice versa, informing policies and practices, strengthening reporting on environmental determinants of health, and reducing the environmental burden of disease, including those spread by zoonotic transmission.
IUCN is well positioned to elevate the visibility of the One Health approach by demonstrating the vital links between biodiversity, ecosystem integrity, and human and animal health. As a global leader in a wide range of issues that are key factors, both for environmental health and well-being, IUCN can use its convening power and credibility in the conservation and wildlife sectors to amplify and strengthen One Health approaches for the mutual benefit of both people and nature in our rapidly changing world.
Human health is closely connected to the health of nature. Protecting forests, conserving biodiversity, and restoring ecosystems helps reduce disease risks and strengthen resilience to climate change. A One Health approach reminds us that solutions for people, nature, and climate must go hand in hand. The task now is to scale these solutions and turn knowledge into action.